Hello everyone, I am Dr. Shankar Dey. Welcome to fourth session of NEET-PG 2022 recall question discussion. So starting with question number 31, a patient with history of hand-foot disease for 6 months, history of chest pain and infection 2 years back, HPLC shows increase in hemoglobin F, hemoglobin A2 and S peak is high. History of blood transfusion was also present. So what is the diagnosis? So in this case you can see there is history of hand foot disease. This actually basically the examiner means to say this is dactylitis or inflammation of digits of hand and foot along with chest pain that may be due to acute chest syndrome. So dactylitis, acute chest syndrome along with S peak in HPLC, high hemoglobin F and HB2 seen in this is a typical case of sickle cell anemia. So diagnosis in this case will be sickle cell anemia, hemoglobin S disease or sickle cell anemia. Coming to the question number 32, elderly female patient with gastric carcinoma. This type of image was given, I think so. So this is a image of acanthosis nigricans. So this is acanthosis nigricans. As all of you know very well, this acanthosis nigricans is associated with metabolic syndrome like insulin resistance. It is seen in gastric carcinoma, PCOS, polycystic ovarian disease, metabolic syndrome, etc. So this acanthosis nigricans is not associated with addition, hypothyroidism or hyperparathyroidism. It is associated with metabolic syndrome. Coming to question number 33, child with knee joint pain and swelling. Peripheral blood smear shown. This is the peripheral blood smear. As you can see, there is presence of sickle cell shapes in the peripheral smear. So this is sickle cell anemia. So the baby or child is having sickle cell anemia now presented with knee joint pain and swelling. X-ray was suggestive of lytic lesion with sclerotic borders along the radiolucent area. So the X-ray was suggestive of osteomyelite, some lytic lesion, as the aspiration from the lesion was suggestive of infection. So this is a case of osteomyelitis in a case of sickle cell anemia. So the most common organism responsible for osteomyelitis or bony infection in sickle cell anemia is Salmonella. So the causative organism can be diagnosed as Salmonella. Coming to question number 34, identify the type of aspectial death or mark. So this is ligature strangulation. Why this is ligature strangulation? Because this is complete. This ligature mark is complete. This is not oblique. This is transverse and below the thyroid cartilage. That is why below the thyroid cartilage. That is why it is ligature strangulation. What is the difference between hanging and ligature strangulation and ligature mark? In case of hanging, it will be oblique. So the ligature mark will be like oblique. So oblique and on the upper level. Okay, it will be oblique, upper level, high in the neck above the thyroid cartilage, and it is incomplete at the site of knot. And in case of ligature strangulation, as you have seen in this image, it is transverse, complete, below the level of thyroid cartilage. This is ligature strangulation, and these are the other differences that you must know. So, and in case of throttling, you will see different penny bruise or thumb impression. So thumb bruise will be seen in case of throttling. Finger imprint will be seen in case of throttling. This is not absolutely not mugging. So the correct answer is ligature strangulation. The enzyme affected in case of lead poisoning, ALA synthetase, no. ALA synthetase is not the deficient enzyme. The deficient enzyme is rather ALA dehydratase. So Aldehydatase and ferrochelatase enzyme inhibition causes anemia in case of, so this enzyme is inhibited. So the enzyme affected or inhibited in case of lead poisoning is ferrochelatase and aldehydatase, not uroporphyrinogen 3 or 1. So let's learn something about lead poisoning, also known as plumbism or saturnism. So as all of you know, the popular mnemonic A, B, C, D, E, F, G. A for anemia. This anemia is because of inhibition of two enzymes, as I have told you. One is aldehydatase and another is ferrochelatase. So because of inhibition of these two enzymes, there is decreased hemoglobin synthesis leading to anemia. Then B for basophilic stippling, as here you can see these RBCs are stippled with some basophilic material, as you can see the mark. So this is basophilic stippling. See the mark, basophilic stippling. So basophilic stippling. Then after basophilic stippling, B for Bartonian line. As you can see here, the bluish line or deposit over the gum. See the bluish line over the gum, just below the gum. See the bluish line. So this is Bartonian line because of due to lead sulfide. Next, C for colic, abdominal colic and constipation. D for drops like reed drop, foot drop. E for encephalopathy, lead encephalopathy. F for facial pallor because of vasospasm. And G for gout, Saturnian gout. So G for gout. So this is ABCDEFG about lead poisoning or plumbism. Next, coming to question number 36. 30 years old female following COVID-19 infection after 8 months had severe hair loss since 1 month. So history of COVID infection was there 8 months back. Then patient is now having complaint of severe hair loss for last 1 month. What is the diagnosis? Whenever there is some insult or major stress, surgery, infection, and in case of postpartum period, there is premature entry of hair into the telogen phase, and that is followed by severe hair loss. So this is known as telogen effluvium. Telogen effluvium usually occurs following surgery, major stress, infection, and in postpartum period. See the hair loss, low hair density. So this is telogen effluvium. So this is a typical case of telogen effluvium. Anagen effluvium usually occurs following chemotherapy. Anagen effluvium, chemotherapy or radiotherapy. Dystrophic anagen phase occurs and hair loss occurs. So this is anagen effluvium. Effluvium mean shedding of hair, and depending on the phase involved, it is called anagen effluvium or telogen. In this case, this is telogen effluvium. Coming to question number 37, single nucleotide change resulting in stop codon. Whenever mutation causes insertion of stop codon, then it is called as nonsense mutation. It is called as nonsense mutation. All of you know about the stop codon. What are the stop codon? UAG, UAA and UGA. Okay, so 3 stop codon. Whenever any mutation is associated with insertion of stop codon, it is known as nonsense mutation. It causes premature translation. Next, coming to the premature translation of RNA. Next, coming to question number 38. Following road traffic accident, a 27 years old female, following road traffic accident, it is a male, after 2 days of accident developed dyspnea, petechial rash and sudden loss of consciousness. So what is the diagnosis? So this is the typical history, road traffic accident, and after 2 days patient is having triad of shortness of breath, petechial rash and LOC. So this is typical case of fat embolism syndrome. So the answer is fat embolism syndrome. So this is fat embolism syndrome. Next about the Gart's criteria of fat embolism syndrome. So this is Gart's criteria, major criteria and minor criteria. At least one major and four minor is necessary for the diagnosis of fat embolism syndrome. Among the major criteria, petechial rash, that was mentioned in the question, respiratory deficiency, that was also mentioned, dyspnea, cerebral involvement, loss of consciousness was also mentioned. That means everything was mentioned in the question. Then minor criteria includes tachycardia, fever, retinal hemorrhage, jaundice, renal sign, thrombocytopenia, anemia, high ESR, and fat macroglobulinemia. So these are the minor criteria. As the three major criteria are met following road traffic accident after fracture of long bone, this fat embolism syndrome may occur. Coming to question number 39, identify the type of wound. See, there is presence of wound over the three fingers, parallel wound. So this is nothing but defense wound. How this defense wound is produced? This defense wound is an injury when the victim of attack, injury received by victim of attack. So this is the victim of attack due to immediate and instinctive reaction to the attack while defending against the assailant to save himself. So this type wounds are mostly found in the hands and forearms because as a quick response the victim might have raised them to guard the top and the face. See here, the victim has raised his hand to protect himself or herself, that will cause injury over the hand. So this is nothing but defense zone. Coming to question number 40, a 35 years old female has complaints of arthralgia, oral ulcer, rash, and now develop oliguria and hematuria. So female patient with arthralgia, oral ulcer, and rash along with oliguria and hematuria. This typical case may be seen in case of lupus nephritis, because female patient with this type of rash, butterfly rash, though the typical rash was not mentioned, but suppose this was butterfly rash with some oral ulcer, that may also be seen in case of SLE, like some oral ulcer with oliguria, hematuria, maybe a case of lupus nephritis in a case of SLE. Lupus nephritis classification, histopathology classification you should know, because this may be asked in the next exam. Minimal mesangial type 1, type 2 is mesangial proliferative, type 3 focal lupus nephritis, type 4 is diffuse lupus nephritis, this is most common, diffuse lupus nephritis, type 5 is membranous lupus nephritis, and type 6 is advanced sclerosis lupus nephritis. And this is another important question that may be asked in the next exam. This is full house effect. So this is full house effect of seen is immunofluorescence in case of immunofluorescence study of renal biopsy in case of lupus nephritis, positive IgM, IgG, IgA with C1q, C3 and C4. So this is a case of lupus nephritis. So in the next video I am going to discuss question number 41 to 50. Stay tuned for the next video and don't forget to subscribe my channel Dr. Shankar Dey. Thank you for watching.